Welcome to the Egg Whisperer Show. Today we're going to talk about unlocking fertility potential, how regenerative medicine is changing the game. Imagine a future where cutting-edge science helps restore fertility and rejuvenate reproductive health. Dr. Verdiales, Dr. V, is at the forefront of this transformation, and she's coming on today to talk about using umbilical cord stem cells, exosomes, and ovarian PRP to give hope to women over 40. In this conversation, she shares how these groundbreaking treatments work, who they can help, and what the future of regenerative fertility medicine looks like. Originally from Puerto Rico, she earned her medical degree in 2001 before completing a residency in obstetrics and gynecology in New York City, where she developed a keen interest in reproductive endocrinology, minimally invasive surgery, and pelvic constructive procedures. Then in 2009, she moved to Georgia to start a private practice, gradually embracing a more holistic approach to healthcare. Seeking to expand her expertise, she earned a Doctor of Naturopathy degree in 2017, integrating natural wellness practices with cutting-edge medical technology. She is a pioneer in regenerative and anti-aging medicine. She incorporated stem cell and other cell therapies in her practice in 2023, and she's dedicated to finding personalized solutions for her patients. She believes that no question should go unasked as she helps individuals achieve their fullest potential. And if she wasn't busy enough with her busy practice, she also happened to write a book, which I have a copy of right here, called The Healing Circle, a story of health, science, and love. Welcome to the show, Dr. V.
Thank you so much, Dr. Amy. And wow, with such an introduction, it's like, I think I like myself even a little more right now.
Well, I think we're the same age because I graduated from medical school in 2001. So, when I see a patient who's
Oh,
40, I look at her, I'm like, we are young. I mean, don't get me wrong.
right.
But
It's like, God,
I see the patient, I'm like,
hello.
you're 40, you're young.
That's right.
So your
That's
journey in
exactly my reaction.
exactly. So your journey in medicine has evolved from traditional obstetrics and gynecology to a more regenerative approach. What inspired you to focus on treatments like umbilical cord stem cell therapy, exosomes, and ovarian PRP?
The beginning of my transformation as a human being and as a doctor actually started in 2009, where I found myself dealing with a critical scenario. There's nothing like when bad news hit home. So at the time, I was married and pregnant with my fifth child. And the father of my kid was diagnosed with advanced 3C rectal cancer. And that took me for a loop because you think in your 30s, 20s, 30s, you're invincible, nothing can touch you. I was kind of starting my career. I had finished my boards, had some experience. I was ready to start my first practice, and we got hit with this. And so in that journey of trying to find alternatives on how to keep him alive, because he was given a diagnosis and only 6 months of life as a prognosis. And I was not ready for that. I was like, oh my God. So I'm going to be a widow and I'm going to be left with small children and a newborn. So my personality, I'm a warrior, I'm a fighter. I was like, we're going to find everything and anything that's out there. And so from becoming almost an expert on chemotherapy and all the research on which one works the best, to radiation, to pros and cons, to diet, to the anti-cancer diet, to herbs. Once you start going down a rabbit hole, then it starts spreading out. And the more questions you get, the more answers come out. And then the more questions happen. And it's a limitless journey of understanding, learning, and exploration. Through that experience, instead of 6 months, he actually stayed with us 4 years. And it was through my experimentation. It was not so much the chemotherapy and the radiation and the 32 surgeries he underwent. But I saw miracles. You cannot unlearn what you've learned or unexperience what you experienced. So it was a massive transformation. It's almost, I feel like I took the pill from the Matrix and I woke up. I was awoken, never to be asleep again. And I realized that the box that I was raised as a traditional MD was not the box that limited me. There was a world out there of possibilities, endless possibilities, because the understanding of how our bodies and the biology and our universe works is really, really limited. So that's how I started learning a little bit more about other modalities, cutting edge, experimental stuff, clinical nutrition, herbal medicine, Chinese medicine, acupuncture. I mean, endless information that I just kept going over through the years. Finally, after his passing, then I had a little bit more time because I was a primary caretaker for that time. I dove in head first and finished my degree in naturopathy because I wanted to have like more structured learning and be exposed to multiple teachers and views, because that's how you eventually create your own. So that's how my journey started. Through that process, I did come across PRP in multiple areas, because the first people that started doing PRP was orthopedics. So I was exposed to that, pain management, and cosmetics. And anti-aging kind of goes hand in hand, whether you want to feel younger and biologically be younger or you want to look younger. Techniques are very, very similar, if not the same. And once you understand the concept, then it clicks. Something just went, okay, well, if I'm trying to cause reversing of aging and restructuring of your elastin and collagen in your skin, then that could be used somewhere else. And that's why it works in orthopedics. So I started researching what other areas in medicine and found the papers on intraovarian PRP that came out of Greece with Dr. Pantos. And I was like, woo, I found the Holy Grail. At that time, I was doing functional medicine, so women's health from A to C, doing primary care and all sorts of alternative protocols. And so I incorporated some of that with my patients. Because I was more dedicated to pelvic reconstruction and incontinence, then my population has always been kind of 35 plus for most of my career. That's the group that I've served. And that same age group wanting to be pregnant, second marriage or whatever. And so I started incorporating some of those techniques in my practice. And just one thing led to the other. Eventually, I did join CNY Fertility as part of their team, brought PRP into CNY Fertility, because that was when I started doing PRP was like 2013. I was a weird person among my peers. They would stop at me in the hospital and go, "Are you okay? We're losing her. Yeah, I think the husband's cancer is getting to her." So fast forward, join CNY Fertility. So then fertility just pretty much sucked me in. Then I started researching what else. The buzzword of stem cells was like coming around, but there was no information in the US. And so I flew down to Mexico to a seminar on regenerative medicine and stem cells and all, whatever else is going around the world. And I was synchronicities, God, call it whatever. I walked into this seminar on stem cells, and it was several doctors. So it was on sports medicine and critical care. And the critical care guy mentioned that he was the medical director of a stem cell lab, and that part of his own introduction was his experience with stem cells. So I jumped on him at the end of the conference. I want to know more. I have all these questions, and so we ended up spending a few hours together when he answered all my questions. And then eventually I did go travel and visit the lab. I'm very picky, so I wanted to see how it is, how it works. And he's like, "Do you want to try it?" And I was like, "Hell yeah." Right here, go on. And so I tried it myself. I wanted to see what it was like. And then I started just sharing it with my friends. They were like, what are you going to go do in Guadalajara? I was like, well, I'm going to go see like this doctor, and he's going to, give me some stem cells to try. Can you imagine? And so I have doctor friends. They were like, "Can we go with you?" long story short, next thing you know, I have like 6 people that are traveling with me, mostly like nurses, NPs, and doctors. And they were like, I've been trying to get pregnant. And I mean, I am totally willing for you to inject me anywhere and everywhere. And I said, well, I mean, there's nothing out there. Like when I started doing this, there was zero data. And so I had an injection and I'm fine. The data on other organs, and that's something that I discussed with Dr. Nario. There's data on injection to other organs to cause a more localized healing, and there was no adverse reaction. So I said, well, if they're injecting livers and other organs and joints with this stuff, why not inject the ovaries? It's an organ. And so that's where the experimentation, exploration began, January of 2023. And since then, it's been just like this crazy journey on tweaking the protocol and going back and forth and seeing what works best. And so we do have some preliminary data that I'm very excited about, and the even more subgroups and who, for whom it works better and so forth.
Well, I want to hear all about that. So who does it work better for?
I would say it helps 90% of the people. Because of the way that placental stem cells and cell therapy works, it works extremely well when there is inflammation and injury. Those two things have been extensively proven to work. So, for example, on a younger woman that suffered from an injury because she had chemotherapy, for example, or she had injury to the ovaries, those tend to bounce back a lot better. Once you're dealing with physiologic menopause, that gets a little more blurry. I had a friend doctor. She was one of my pioneer crazies. She is a beautiful cardiovascular surgeon. And she was like, you know what? I want to do this because I've heard great things for cardiology. And so it's like, I want to try it on myself. And she actually was going through menopause, FSH high, AMH low, skipping periods. And by the time that she had down with me, she had no periods in 4 months, full-blown symptoms. And she's like, I'm not ready to do donor eggs or IVF, but I really don't want to go through menopause right now. She found love later in life. And so her menopause was completely reversed. Full parameters. Her AMH doubled, FSH dropped, all her symptoms gone, and she started having periods every month with documented ovulations. She did not get pregnant. She was 50 and she's 51. She actually started having symptoms again, and she's like, I need more stem cells.
So how long did her menopausal symptoms go away for?
A whole year.
Wow, that's impressive.
A whole year.
That's impressive.
So I haven't had anybody get spontaneously pregnant past 48. I would say the bulk of the patients have been 43 to 50. I've seen a decrease of ovarian reserve due to fragile eggs or genetic permutations. Those have had very minimal response. I think that once you get into something like that, there's so many factors involved that even though they felt better, it was a lot shorter, the bounce back. We did have one of our fragile X premutation patients had 2 spontaneous ovulations and then reversed back to menopause.
I see.
And so we've had 5 spontaneous pregnancies, just natural pregnancies, and 3 live births.
Wow.
With menopausal symptoms gone, you do feel it. You do feel better. Yeah. So even for anti-aging. So we had another patient, for example, low ovarian reserve in her late 30s, but with ulcerative colitis. So kind of autoimmune type of stuff. And she had 2 rounds of stem cells, like 2 months apart. Unfortunately, her fertility was not improved, but she did go for a colonoscopy, and the doctor was like, what did you do? I mean, your colon is like spotless. I've never seen your colon this good. I mean, what did you do? You're not taking meds right now. And she's like, well, I went for 2 rounds of stem cells.
Yeah.
I've had another patient. She's 48. She's a nurse. And her eyesight was restored. Wow. So she's had 2 rounds of stem cells too. Her AMH went from 0.03 with an FSH of 100 to 0.08. Even though it's not perfect, it's doubled.
Yeah.
And her FSH is down to 22.
Wow.
And her eyesight is complete. Like, she's like, the craziest thing is I suddenly realized I was reading without my glasses.
Wow.
And so we get stuff like that.
Yeah. And what's the experience like for a patient? So for someone who's interested in working with you, what's the first step they take and what can they expect from there? Where do they go in Mexico? Tell us about, like,
Absolutely.
they go to the building, is it, they get an IV? Take me through the steps.
Of course, I like to create a relationship with the patient ahead of time to, one, see where they are, where they've been, and then give them realistic expectations based on age, history, medical history, etc. Because now we have enough data to guide them a little better through the process. I believe in a whole approach, right? There's no magic pill. So it's like we talk about diet, we talk about spirituality, emotional stuff, what brought you here and what's your goal, supplements. So I do the kitchen sink approach. Once they decided to go to Mexico, then they get there to the Cancun airport. They can take a taxi, they're safe, or we do have a tourism company that helps us. So there's transportation, there's hotels nearby. The clinic is in Playa del Carmen. Through the years, I've developed it's a 2-day program, and there's some logic to the madness. And then they get an infusion one day, and then they get the intraovarian PRP with stem cells and exosomes the next day. And some of the reasoning behind it is that because of the research, at first I was doing it all together. And then I thought, well, there's so much that you can obtain at once, and too much of a good thing is a bad thing. And we know from all the research and all the documentation of stem cells in other areas of medicine that 60% of the stem cells utilized are going to go to vital organs. There is wear and tear, ovaries and uteri, as you know, are end organs. They're non-essential for survival. Therefore, if your ovaries are shutting down, it's because your body is diverting energy and food to other organs first. So you have to nourish the whole body before there is leftover or enough food for the ovaries and the uterus. So you have to have some sort of systemic approach, and that's what I try to do first. I try to address the whole person, give them a whole systemic. So if there's any old injuries or there's any lung problems, liver, we'll take care of that first, because that's going to happen regardless. And because stem cells are smart, they say they have a humming device. They will migrate. They will migrate from where you put them to where they're needed. So even if I were to just, inject them into the ovaries and the body perceives, hey, the ovaries are great, whatever, but you know what? It's like this person has been exposed to black mold for 6 months. Let's go fix the lungs first. So we take care of the person first and then go take care of the ovaries.
Yeah, totally. And then as far as the stem cells, where do you get them from?
So I get them from a lab that's based in Guadalajara. It's called CBC Cells. And the reason that I chose the lab, because, outside of the US, you don't know what you don't know. The doctor that I was at the conference, I got to meet him, create a relationship, get to know him more. Like I told you, I went to the lab. I saw the quality control measures. The lab is not only fully certified nationally, but internationally by the International Association of Cell Therapy and the European Association of Cell Therapy. They have published research on their cells, documented data. They also have third-party quality control. So it's a very serious lab. I felt comfortable enough that in the first trip, me, my husband, and my family got infusions. And I believe that if I don't feel comfortable doing it to my children, it would be unethical to tell somebody else to do it. Right. So that's how I practice medicine. And that's why I use them.
Yeah. And so the stem cells are coming from banked cord blood from a public cord blood bank?
The stem cells are coming from donated placentas and cords of young women that ended up in healthy pregnancies. The mothers are fully tested with all the STDs and all the testing. They even have pre-COVID stem cells if anybody wants them. So non-vaccinated women prior to COVID, there is some in the lab bank. You have the choice of doing placenta or Wharton jelly. Wharton jelly, it's a little more expensive because there's less material per placenta. So it takes a little bit more to get the same concentration of cells. But from the discussion with the doctor, with Dr. Nadio, he feels that the difference between the two, yes, Wharton jelly might be a little better, but then the expense, it's not enough to always do it. A question that I personally had when I went to talk to him is like, isn't there like a host versus graft reaction? I mean, it's like a foreign cell running around in my body. It's going to just, my immune system go crazy. And no, because if you really think about the physiology of the placenta, it's a natural buffer between the fetus, which is a foreign object, and the mother, so it doesn't get rejected. So it naturally does not elicit any signature proteins on the cell membrane that could be interpreted as foreign. So it bypasses the mom's immune system. Otherwise, we would all be aborted.
Right.
So that's how they can, sneak our own immune system. The second question that I had, and my patients ask all the time is, okay, is this DNA from a foreign person going to be incorporated into my body somehow? And the answer is no. From stem cell research on animals, we know that they last from 7 to 21 days, depending on how they go into the body. So if it's an IV infusion, it's 7 days. And then the longest it lasts is an intraperitoneal infusion that's 21 days, give or take. And so, no, it's not going to be incorporated to your egg. What it does, it works via 3 mechanisms. One, the stem cell itself will release exosomes as it's injected into your body, and those are signals for your body to start the healing process. So it kind of rescues cells instead of going into apoptosis or cell death, but to go into regeneration and healing. And so it works that way. It also throws some peptides into the blood or into the surrounding area that are anti-inflammatory. And 3, it actually has a cell-to-cell interaction. So it talks to your cell in a kind of a paracrine way, saying, hey, you're not doing what you're supposed to do. Remember your programming, come back to us. Focus. And so it just pushes the body towards healing instead of aging. And then they die off and your body takes over from there. And even from PRP, which it's your own natural healing proteins and signals that you're using and you're manipulating, you're pushing the person into that direction of healing and regeneration, and then the body takes over. And that's why the effect is different from everybody. Even on my years doing PRP, you can get no response, a little response, or a dramatic response, depending on how those signals are received by the body and overall health of the patient.
Yeah. And what are the risks? Like, is there any risk to injuring the ovary, risk to any organs around the ovary when you're doing the procedure? Have you had any complications?
So the risks are like any invasive procedure. Yes, you are poking the ovaries. So yes, there's risk of bleeding, infection, damage to adjacent organs, just like any surgery could have. Knock on wood, we haven't had any major complications. We've had a little bit of bleeding. We did have somebody create a little hematoma. Allergic reactions, I think we've had our first allergic reaction in 2 years. And I don't think it was the stem cells. It's hard to pinpoint because of the kitchen sink approach. I think from experience, it was more of the placental peptides that caused the reaction because it was like a skin hives that just spread. I do inject placental peptides into the patient subcutaneously. And then she's been dealing with hives and I had to give her prednisone and so forth. But she's been the first one in 2 years to have a full allergic reaction to any of the products. The risks are really, really low, there is a reaction to the stem cells that can happen, and they call it the cytokine storm, because they will flare up your immune system. And I had read about it, but I actually experienced it. One of my trips to Guadalajara, I told Dr. Nadio, okay, I want to feel a cancer dose. Give me the cancer dose. What dose do you give to a cancer patient that you're trying to rescue? And he's like, are you sure, Maribel? It's like, yeah, come on, give it to me. I'm going to take it. So he did. And an hour later, I had fever and chills. I felt like I had COVID. It was like, okay, whoops. He was laughing at me afterwards. It started about 45 minutes to an hour after the IV infusion. And the next morning I was fine, but I have to say it was not pleasant. So that's like a dramatic effect, and it's just your body responding because you are manipulating the immune system. So every time you manipulate, it's like having a vaccine and getting that flu feeling. So it's kind of the same thing.
Yeah. I love this conversation. Thank you for doing what you do, because my approach is to leave no stone unturned. And I feel like every patient who's exploring donor eggs should be given all of these options so they can make the best decision for themselves.
Absolutely. And we live in a world where bullying is like bad, and and you have to be careful. But women, older women, I should say more experienced women, seasoned, sexy mamas, trying to have a baby are bullied. And I'm sure you see it all the time. It's like by the time they get to me, they've seen 3 fertility doctors that have told them, what are you thinking about? I had a patient where she was actually completely turned away. It's like, go away because, you already failed. They let her do a cycle of IVF. And of course, results were not great. They were not horrible. She had 3 eggs, 1 embryo, did an implant. And they were like, either you do donor eggs with us or we're not going to treat you because, of course, you're going to damage our stats and we don't want that. So by the time they get to us, it's almost apologetic. They come in and they're like, I'm sorry. I know that, and they just don't even look at you. I'm sorry, but I still feel that I want to give, have a chance. I'm like, hell yeah. You're just beginning life. There's no reason to feel ashamed about this. Those people out there, they're not paying your bills.
Yeah, patients are getting bullied every single day in clinics all over this country and world, and they're made to feel like there's something wrong with them.
Like they're like, that they should go somewhere and die and wait for the grandchildren.
Exactly.
It's like, no, life is not over until it's over.
Yeah.
And there's nothing worse than going to your deathbed with a question that's unanswered, with a dream that you didn't try to follow. I mean, I think that not all of my patients will have a biological child, but I will try as much as I can to help them close that chapter in peace. And then for them to know, because I'm a girl and we are in that age group of sexiness. So if I wanted to have a baby right now, why should I limit myself to even try?
Right.
And if it doesn't work and the next step is donor eggs, then it's okay because I gave myself a chance. Yeah. And a lot of these girls, they don't get a chance. They're like, donor egg. Oh, donor eggs or get out of my office.
Right.
It's terrible. And just like somebody had to run the 4-minute, mile, and then everybody was running the mile in 4 minutes, we are redefining aging and life expectancy and what's possible every day. In my 23 years as a physician, and I'm sure that you share this, I've seen paradigms shift completely.
Right.
What was thought to be good, it's bad, then it's good. A medication was great, then it's awful, then comes back with a different. It's like the truth, it's never absolute. And so we're all pushing the envelope together as we allow the questions to flow and the possibilities to come about. A question arises to find a solution, and then the possibility pops, So even in that search, is like I ended up on the other side of the world a few weeks ago in my craziness of what's next. And now you can even have a 3-parent baby
Yeah.
and do the pronuclear transplant. I thought this is the next step to what I'm doing. I can
Right.
take them here, and then this team of doctors can push a little further. And so I had one of my stem cell patients there, and it was not planned. And again, God synchronicities. One of my stem cell patients happened to be there transferring her baby when I was there, which was very exciting. And now she is pregnant at 46 with a girl because the way the embryos developed after the pronuclear transplant, they're able to do PGT testing on all of them.
Yeah.
So we know it's a girl.
Yeah.
And it's biologically hers. Yes, it
Right.
has somebody else's mitochondria, but who cares?
Right. Right. Where was this that you did this?
It's in Albania
Okay.
with the team of Dr. Uliana and Dr. Birol.
Okay.
So I know there's really cool things happening all around the world, and as physicians and scientists and discoverers,
Yeah.
we need to work together to change the ideology and to teach each other new things,
Yeah.
you know? I
And will you
mean,
be doing it
Christopher
in Mexico?
Columbus was
Yeah.
told he was crazy.
Yeah. Yeah. Well, I get that a lot. I say I'm just crazy about helping you make a baby. And if any doctor wants to say that about me, I take it as a compliment. Thank you very much.
There you go. There you
So are
go.
you going to bring MRT and pronuclear transfer to Mexico, or are you going to be taking a team to Albania?
I've created a collaboration with the team. Right now, unfortunately, it's not legal in the US. It's legal in very few countries. They're not prepared to take that to Mexico just yet. So, for people living on this side of the world, they would have to travel over there to get tech technology. Down the road, I would love to bring that to Mexico. A lot of things need to happen, but I think eventually that's where it's heading.
Well, that's very exciting. Yeah, I mean, you've helped so many of my patients since 2023 when you started doing what you're doing in Mexico. And so I'm really glad to have this opportunity to talk with you today, to have you teach us about your past and your journey. Thank you for coming on. Thank you for joining me. Thank you for your book. We'll make sure to include a link to the book in the show notes. And we can't wait to have you back on to talk more about your experience, what you've learned, so that, more people can hear your message and my message of hope that it never killed anybody.
That's right. And I am so honored that we finally were able to connect this way, because I love to connect with people that we're all working parallel, and together we're going to make this a better place.
Amen to that. Thank you so much. Thanks
And
again.
thank you for
Have a
inviting me.